So I think it's important because, especially women, we tend to really worry about our breath. We can identify a problem, whether that's by mammogram or physical exam, or our partner finds something. Some lucky people can tell when their blood pressure is elevated. They get a headache.
Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona Chin, co-founder of a Kidney Coach, Kidney Disease Solution, and our formulas Genesis. And I'm joined again today by the beautiful, amazing Dr. Ellie Campbell and her dog there in the background.
Yeah.
And Ellie is a family physician, a functional medicine doctor. And what I love about Ellie is, and if you go back and watch some of our other podcasts, you'll see her story about how she really got into functional medicine through treating one of her favorite patients, and her story of what happened with her journey, which is really amazing. But the other thing I want to say about the amazing Ellie Campbell is that she has just written a book called The Blood Pressure Blueprint, and it is all things blood pressure and how to treat it. But what is really amazing about this book, there it is, thank you, hold it up, be proud woman. It's an amazing book because think everything you know about blood pressure and just think salt and diet, not exercising, and then think, throw it out the window, you don't know anything. Dr. Campbell knows everything about blood pressure, because there are so many things that contribute to elevated blood pressure and cardiovascular disease, leading to things like chronic kidney disease and all of those sort of things that most of us aren't taught about. Know that hypertension is the second leading cause of chronic kidney disease, being end stage of that, and that heart disease and heart failure and heart attacks are, I don't know, where do they sit on the cause of death in the US and
Yeah,
the world?
US #1, cardiovascular disease, the #1 killer in our country.
Right.
February is American Heart Month, so we do like to focus our attention on hearts during February. It also happens to be Valentine's Day.
It
Um,
does.
and so I think it's important because, especially women, we tend to really worry about our breast health. And the media attention to breast health is wonderful, but only 1 in 31 women die of breast cancer, and 1 in 3 women die of cardiovascular disease. So
Yikes.
it's a 10 times bigger problem, and people don't pay attention to it. Partly, I think, because breasts, um, we can identify a problem, whether that's by mammogram or physical exam, or our partner finds something, but hypertension is usually silent. Some lucky people can tell when their blood pressure is elevated. They get a headache, or their ankles swell, or they feel a rush in their, or a thumping in their ears. Those are the lucky people, because if
Mm.
they can identify that their blood pressure is elevated, they'll be motivated to make a change. But that's not most people. Most people, it's a silent stealer of vitality and organ function. And if we identify it by properly checking our blood pressure at home and at the doctor's office and getting trends over time, then we can start to identify who really has blood pressure problems and who doesn't. Because there's some sneaky
So
things.
we've got sleep apnea. What else can happen? Is there anything else in the oral cavity? We've spoken about pH, nitric oxide, sleep apnea. What other things not people not thinking of when it comes to blood pressure?
Yeah, I think we are starting to understand, maybe as a society, that inflammation is a driver of hypertension, right? And
Yeah.
we know that if you have an untreated autoimmune disease, you'll have inflammation. If you eat nothing but junk food, you'll have inflammation. But I think what people don't appreciate is if they have gum disease, or also called periodontal disease, that they also will have a source of inflammation. So if you brush or floss your teeth and you see pink in the sink, to me, that's a 911 dental emergency. That says, Mr. Mrs. Dentist, please assess my mouth for inflammation. Now, I'm a primary care family practice doctor, and I have a SPY test that I can do that tells me if you very likely have periodontal disease. It's a blood test, and it's called high sensitivity C-reactive protein. It's a non-specific marker of inflammation. But when I pair that with another test called LPPLA2, which stands for lipoprotein associated phospholipase A2, it's an enzyme that's made by white blood cells when there's inflammation present. And we typically thought of that for many years as a marker of cardiovascular inflammation, a marker of atherosclerosis and hardening of arteries, and a marker that the blood vessels themselves were being plaqued and inflamed. But we now know that periodontal disease will do this as well. So if I see LPPLA2, high sensitivity C-reactive protein, and the patient has any gum symptoms whatsoever, tenderness, pink in the sink, pink when they brush or floss, a metallic taste in their mouth, they're going to the dentist and they're going to be checked for periodontal disease.
Yeah.
Also, when it comes to periodontal disease, some people have a pretty clean looking exam. They don't have bleeding on probing. They don't have pink in the sink, but they do have inflammatory mouth bacteria that are living there. So many people in functional medicine are familiar with doing a digestive stool analysis, a poop test, to look at the bacteria that live in your gut. Are they out of balance? Are there invaders that shouldn't be there? Are there parasites or yeast or other bacteria that are causing trouble? Well, the same can be true in your oral cavity. We're supposed to have bacteria there. We need them. They help keep our gums and teeth healthy. But bad bacteria are bad actors, and bad bacteria can cause inflammation. And there's 5 of them that are the main triggers, and they have long names, and we just use their initials, AA, PG, TD, TF, and FN. We can do a spit test and look for these mouth bacteria. So when someone has elevated LPPLA2, high sensitivity C-reactive protein, we spit test them, and then we can target their periodontal treatment to eradicate those bacteria. Sometimes, rarely, that requires an oral antibiotic. Sometimes it can be done with herbal medicine. Sometimes it can be done with a change in your home care, getting an electric toothbrush instead of a manual one, using a water flosser instead of a stick floss. Sometimes it's oil pulling. Sometimes it's laser treatment. Sometimes it's piezoelectrode. Sometimes it's guided biofilm therapy. There's a whole litany of treatments that your hygienist and dentist can work on together to eradicate those ugly mouth bacteria, because who would have thought that bad breath or gum disease bacteria can raise your blood pressure?
I highly recommend it to anyone with kidney disease, especially if you know hypertension is a driver or anyone in your family has hypertension. Again, I'll put all Dr. Campbell's details below and a link to the book. If you want to know more about what we do, head to www.kidneycoach.com. We're also on Instagram and Facebook and all those good places. Remember to hit subscribe and like. That way you get notified when I get Dr. Campbell back on to talk all things micronutrients when it comes to elevated blood pressure. Dr. Campbell, thank you again for your time. I know you've been busy and just got back from the Amazon and just celebrated a birthday not long ago. Happy birthday.
Yes, I did. Thank you so much.
Pleasure. And again, thank you for being part of our community, and we look forward to seeing you all next time. Bye.
Yes, ma'am. Bye now.